Welcome to Dental Success Beyond Chairside, the podcast that's dedicated to revolutionising the way dental professionals succeed beyond the dental chair. Join us for a unique blend of insightful interviews with industry experts to help you thrive in your dental specialist practice. In each 20-minute episode, we'll delve into a variety of subjects, including HR, marketing, innovative techniques and systems, and AI to help transform your practice and unlock its full potential. Whether you're a dentist or specialist looking to enhance your practice, this podcast is your go-to resource for professional, personal, and profitable success. Hello, everyone, and welcome to today's episode of Dental Success Beyond Chairside. Are you a recent new grad practitioner or clinic staff that assist your dentist with new patient consults? Would you like support with diagnosis and treatment planning? Today, I'm lucky to be joined by Dr Max Ganhewa, who featured in our first episode of this series, speaking about CoTreat Generator. Today, he's on our final episode of this series to talk about CoTreat Colleague. This was the first innovation of CoTreat. Max, would you like to share a bit about how CoTreat Colleague works?
Yeah, absolutely. Thanks for having me back, Michelle.
It's exciting. I was excited to have you. I thought it was just beautiful for our inaugural series to have you first and last.
Appreciate it. So CoTreat Colleague, I would say this is kind of like my pet project within the company, where it's a very deeply clinical product rather than Generator, which is more around case presentation and communication. So first of all, Colleague more or less sits back of house, whereas Generator touches the patient. Colleague is a product for the practitioner and potentially the practice owner or manager. Yeah, so pretty much like you said, it helps particularly new graduates, potentially like lesser trained practitioners, to formulate more accurate diagnoses and treatment plans. So we're very passionate about evidence-based dentistry. So this is essentially a safety net that can exist under a treatment plan to make sure the practitioner's decision-making process has been sound and evidence-based. So what Colleague will do essentially is it'll take the dentist or the practitioner's treatment plan from the practice management software. We'll take a set of images from the image viewer. So we can do photographs and radiographs. So using a combination of the two data points, we'll create an independent report, and we'll automatically cross-correlate our independent report to the dentist treatment plan and essentially say, have you considered doing this is potentially missed? Do you want to add that to your treatment plan? Or conversely, we think that there might be a more conservative item code or a treatment option where essentially we try to get the dentist to change their mind. So consider us a bit of a contrarian opinion that we provide to the dentist treatment plan to try get a better sort of accurate outcome. I think that probably goes back to the name CoTreat. It stands for collaborative treatment. So the idea is AI and the human practitioner will collaborate to make sure the patient's outcomes are elevated.
I think that's what is so great about your innovation, Max, is that it's very evidence-based. When you talked about perhaps looking at different treatment plans, you might actually type in an incorrect code and that could flag. So CoTreat, even though you said you want to work collaboratively with it, if someone's accidentally entered an item code that's incorrect, it can actually flag that.
Yep, that's right. We do that. We do see it from time to time.
Because we not often get audited by the health insurance companies about what you're charging and what you're doing and things like that.
So item codes, as like tooth numbers, we see stuff all the time. It's like, is that a 1-6? Is it meant to be 2-6? Or like if there's a 1-8, sometimes, practitioners chart it as a 1-7 on the treatment plan. So just like these trivial errors, but they can be meaningful if not picked up.
That's exactly right. So when a patient comes in, and obviously you go through and it ties in with the practice management system and it analyzes these x-rays and these photos and things like that. What sort of time frame is it to get around to get these reports and everything back?
Right. So we go broad, Michelle. We've theorized we can do roughly 250 different types of observations. So depending on our data set, we're trying to get it down to 10 seconds or less for the key pathologies. So that's the tech team's challenge. So we're currently in stealth and we're trying to get it launched, hopefully, in about a month's time. But it is a deeply technical challenge, both from a research perspective and an AI perspective. Essentially, both these things have to converge to make sure that we have a useful product, and that's time related. If the patient's already out the door, there's still value. Like we can still report on it, let's say before 7 a.m. the next day. But the real value is communicating with the patient while they're in the chair. That's the goal, at least for the very important pathologies like caries and alveolar bone loss, and try to get it more or less instantaneously. And we kind of define that 10 seconds or less. Yeah, so that's the goal. And as the data,
wow, that's fantastic. Absolutely awesome if you're able to do that. So I can see what you're saying with your research team, and getting everything in line is quite difficult. But if that can happen, that's just going to be fantastic, Max. With the new grad, if they haven't got a mentor, if they're on their own, and it can obviously generate more sales as well if they're not sure what they're looking for or they miss a diagnosis. So how can CoTreat help with creating more income for the practitioner and the practice?
So I would say, like, this is pretty much the founding motivation of the whole company, Michelle. It's finding that win-win between the practitioner and the patient, right? It's like we want to make sure the patient is always like, there's no harm. The treatment that's been done is always evidence-based, right? But in terms of like, and this is my own experience as a practice owner, the less experienced practitioners, they would just leave like ethical money on the table, essentially orthodontics, indirect restorations, implant. They're, I guess, perhaps like the eye can't see what the mind doesn't know, or they're not confident to communicate that to the patient in a way that the patient understands the value and accepts the treatment. So what's frustrating as a practice owner's point of view is like, if I was seeing that patient, I would have treatment planned it and then I would have communicated it. And it's also frustrating that there are other practitioners within the practice that can like provide these treatments. So essentially, that's the origin story, I guess, of Colleague, where patient harm prevention, that's always number one. But also from a practice owner's perspective, like, I just want to make sure I'm running a profitable business. And it was a real problem. My new graduate dentists and some OHTs, hygienists, like, they were fantastic at doing what they're good at, but they weren't always great at picking up the things that I wanted them to pick up.
Well, I do remember when Ross graduated, and he said, when I went into practice, he went into government. He said, well, it used to take me 6 hours to do a crown because somebody would come and check it, and then somebody else would come along and check it, and then they do it. So they're not experienced, and it's totally understandable, and it's just part of learning. So to have that backstop with Colleague to help you actually do that. So when you're presenting it, so obviously we've got the patient in the chair now. This is coming through in real time and you're explaining it. Can it show the patient where these things are so they can get an understanding in layman's terms of what the issues are?
Correct. So that's one of the use cases that we're developing. So right now, being a product for the practitioner, it is still in like very academic sort of language. So for example, for caries on a photo, we use the system called a ICDAS system, which goes from like classifies caries from ICDAS 1 to ICDAS 6. So this is like meaningful for a practitioner, but it's like total gobbledygook for a patient. So the solution is click on ICDAS, and it'll instantaneously light up with what we call a polygon, which is like a little AI drawing on the corresponding photo or the radiograph. So the idea is when the patient in the chair, the practitioner can bring the patient up to their computer screen and essentially show them the independent findings from CoTreat, as well as their own decision-making process, and hopefully find like that good middle ground as to what might be the best outcome for the patient.
So this has obviously been going for a while, obviously not in real time, but how have you found that sort of new grad practitioners or people that are using Colleague, what's the feedback you're getting, Max?
It's like super interesting to see how different people use the same sort of product in different ways. One use case is around mentoring, right? Because with Colleague, like in a patient level, at an individual level, the data is fascinating, but it almost gets more fascinating when you aggregate a bunch of patients into like a week or a month. Essentially, like for me as a practice owner, it's fascinating to see what sort of repeat patterns are emerging with these potentially new grad practitioners, and then it's just kind of, I can wrap my arm around them and say, hey, you know that like your secondary caries rate might be a bit on the high side. Let's talk about that. What can I do to help? Should we go through your technique? So in essence, like it just gives me more data to mentor these guys in a personalized way rather than, like generic sort of,
It's so good. I never actually thought about that. That is fantastic. Yeah. And what else?
Yeah. So, it slices and dices. No, so the new grad mentoring, I think that's a key one, but also just to make sure key pathologies haven't been missed. So reputation is everything for a service business, and dentistry is a service business. So like I built my reputation like painstakingly over 10 years. So like now that I've kind of stepped away to focus on CoTreat, it kind of pains me a little bit to put that reputation at risk. So as a practice owner, like getting email alerts from a colleague to say, hey, this patient might have like a periapical pathology that might have been missed. Do you want to just double check that, or just like nudge your practitioner to see if they've noticed it? Yeah, so from that quality assurance reputation perspective, I think it's really good. And also, like, I guess to standardize sort of workflows, Michelle, where I have 4 rooms in my clinic, right? And previously there were different sort of treatment paradigms, diagnostic paradigms and treatment paradigms across the 4 rooms. So when you use data to help create treatment plans, there's kind of like a hymn sheet like that the different practitioners sort of can sing from. Like if a patient comes in, the odds are they'll get a similar philosophy diagnostically, similar philosophy from a treatment planning perspective. And as a practice owner, I'm happier because I can sort of be a bit more sure that one of my patients that I've cared so much about for the last 10 years is going to be in good hands, no matter who they see.
Absolutely. And I think that is one great thing about this, as you said, just with the systemizing of it. And it's going to be the same. So a patient that knows that they're referring to your practice, not necessarily you, but they're referring to your practice, that they're going to get exactly the same treatment as the other person. And then when you're actually showing it, and you said that it was obviously in clinical language, and then it transfers over to layperson's language, is there a script to help them to discuss what it is, or how? Is there some assistance within Colleague to help them with their verbiage?
Not yet. That's a great idea. We have like the visual where like essentially it'll light up the relevant observation on the image. So we find like patients obviously respond really well to visuals. So in early testing, that's still pretty promising. But yeah, we do have a few sort of use cases, and this touches on Generator. When send these findings to the patient, we obviously don't want any academic esoteric language. So we've gone like it's a one-to-one sort of correlation. This is the academic version of it. That's for the dentist and the practitioners, and here's the patient version of it.
So that's very beneficial to have both your Colleague and Generator, because they go hand in hand to work with actually the treatment conversions. Have you got any statistics of, how much more has been generated through the use of CoTreat?
Yeah, so we're still kind of in the early days for Colleague, which also like we've been essentially in stealth mode, just really making sure the accuracy levels and the speed and the research is done right. I don't have like a large data set, but in terms of the metrics that we're measuring for Colleague, the key metric that we're measuring is treatment plan size. Essentially, this is usually not a metric that practices track, but if you consider it, it's like an upstream metric from revenue generated and hourly rate, because like essentially your revenue is treatment plan size multiplied by case acceptance. So like there's 2 ways to improve revenue. It's either increase case acceptance or increase treatment plan size. Ideally both.
Yeah.
Way, of course, we are not here to overtreat, upsell unnecessary things. Rather, it's giving the patients visibility on things that might benefit with them. And anecdotally looking at the data, it's like orthodontics way underdiagnosed, under treatment planned. Same with implants. Indirect restorations are a funny one. Like there are some practices that are a bit potentially overzealous, and some that just like don't do indirect restorations at all. So depending on the practice or the practitioner, like
It's the practitioner really, isn't it? It's just what they sort of like. And that's with Colleague as well. I was thinking about associates we've had. They like to do certain procedures. So they were always looking out for those particular procedures. That is what they enjoy doing. But as you said, other practitioners within the practice are able to do it. So by having Colleague, look at it as well as the person who's just looking at what they want to do, they can actually see and potentially pass that on to another practitioner to do that particular case. So it's still being kept within the practice, but it's generating a higher income, and you're all working together, and it's all about teamwork and clinical excellence. And this is where this is coming from. And it's tying in with that patient experience as well. And as you said, the reputation that you've built up over a large piece of time, you want those practitioners to be just like that. So by having Colleague, it certainly helps sync all of that together. So then those patients will refer people, they will stay with you, and those referrals that are coming in are getting exactly the same as what the person who received the same treatment, and they're going to stay, get that continuing care. So it's all about attract, retain, and refer. Which is fantastic. Is there anything else that you wanted to discuss that we haven't discussed, Max?
I could speak about Colleague and clinical decision making for hours, Michelle. So maybe if there's anything specifically that interests you, maybe you shoot from there.
Well, I'm sort of thinking there's so many benefits of CoTreat Colleague. So there's obviously your better patient outcomes. You're ensuring patient safety. You're very evidence-based. You talked about being able to notice things that are happening with particular practitioners, so you can actually do one-to-one education with them, and having that sort of mentorship when you graduate is just fantastic. And it's obviously good for them as well, because they're going to get a bit of income at the end of the day as well. So that's great. It's obviously great for the practice owner because you're potentially missing treatment opportunities, so you can get a greater treatment. You can probably treatment convert better as well, because you can show the picture of them, as you said, that works really well. And then in conjunction with Generator to actually show those visuals, you're probably going to get a high acceptance rate. And just going from 50 to 75% just on a 2,000 treatment plan over 40 weeks is like 120,000 per annum. So as gross, which is just huge. And obviously you've got that medico-legal risk as well, and your reputation. And I think with everything entwined in all of that, that's just a fantastic thing for dental practices to consider. So I think if people want to get in contact with you, Max, and talk about CoTreat, please check out our episode description, because we've got everything in there, social media profiles, website, and contacts for Max as well. Thank you so much for joining us today, Max. We really enjoyed having you as part of our first and our final on our inaugural series, and we appreciate your time. And good luck with everything, because you're doing amazing things.
Thank you so much, Michelle. Thank you so much. And I'll keep you guys in the loop as to how Colleague develops, because I think like this is, essentially year 2 for Colleague development. Like we just got such an exciting roadmap for 2025, 2026 onwards. So I'd love to keep in touch. Absolutely,
100%. And we will keep our listeners updated when we're moving into those next series. Thank you so much, Max. Take care. Bye.
Bye.
If you enjoyed this episode, please subscribe to our podcast or YouTube channel. Your feedback helps us bring you more valuable content and inspiring stories from leaders in the dental industry. As we wrap up this series, get ready for our next series. In Series 2, Streamlining HR Operations, Building Stronger Dental Practices, we'll explore effective HR strategies with experts, employment lawyers, and dental practice owners. We'll cover essential topics like legal compliance, onboarding, workplace wellbeing, and managing psychosocial hazards. Join us every second Saturday for insights with how HR processes can transform your practice. Thank you for listening, and we look forward to welcoming you to our next series.